Welcome back to Politics Nation. COVID-19 cases are on the rise across the country, and with it, the critical fight against vaccine misinformation. There are growing concerns over the Delta variant amid the backdrop of declining vaccination rates. But medical professionals are still hoping to see an uptick in communities of color getting the vaccine, like that of Newark, New Jersey. Joining me now is Dr. Sharif El-Nahal, President and CEO of Newark University Hospital and former New Jersey Department of Health Commissioner. Doctor, I understand that your hospital will mandate all staff to have the coronavirus vaccine. We're also seeing this happen in New York City. This decision, of course, has been met with debate. Tell us why you stand behind this, and what do you say to people who don't agree? Say, let's educate people before we mandate them. And they're still skeptical when it comes to the vaccine, among others.
Thank you so much for having me on, Reverend. So, yes, we are mandating the vaccine, and it actually kicks in less than 10 days. But that's not the only thing we're doing. We're having tough conversations with employees that are skeptical up to this point. They have a lot of reasonable concerns, like what are the side effects, what are the long-term effects? And something we're discovering is that a lot of people are still seeing a lot of misinformation and disinformation on social media outlets like Facebook. But we're coming to the table with a baseline level of trust with our frontline workers, our healthcare heroes. We supported them throughout the pandemic. We recognized the history of medical racism and contrasted what we're trying to do now with the horrific episodes in the past, like Tuskegee. And I think it's really working. Just one example, we had one lunch last week. Almost every person in that group ended up getting vaccinated after just less than an hour of conversation. So I do think we're making progress.
Doctor, you worked closely with both Biden and the Obama administrations amid public health crisis. What has President Biden done right when it comes to combating coronavirus, and what is his administration still missing the mark on?
Well, the first and most important thing is that he overtly recognized the issues that folks in our community are facing every day by recognizing that Black and brown people have borne the brunt of this pandemic from the beginning. Much worse outcomes, the number one cause of death in Black and brown people in 2020. And he acted on that. He formed a health equity task force, a health equity lead in the White House who reports directly to him. And all of that really worked in terms of helping to build trust. Another thing he did was he really respects the autonomy of the CDC and the FDA and isn't trying to interfere with CDC guidance, for example, on masking and testing and vaccines for political purposes. And I think that is understood, and it is really understood by the community here in the example of the Johnson & Johnson pause. We're seeing a lot of cases at one point potentially related to the J&J vaccine on clotting. There was an investigation of that, and ultimately was recommended that it's still safe. But the point is that he is letting those agencies do their job and follow the science.
Now, it is a known fact that the pandemic disproportionately impacted people of color, especially those who are Black and brown. In a study conducted by Rutgers University and published in the Journal of American Medical Association, vaccine skepticism in New Jersey was highest among Black and Latinx residents. Let me quote it. It says, fear, illness, and loss experienced during the pandemic motivated information seeking and mitigation behaviors. Vaccine skepticism was high, as was demand for clearer information among Black participants. Racism and medical experimentation was associated with distrust, the end of quote. Now, if minorities in your state are hesitant to get the vaccine, is because trauma caused by the pandemic. What effects might this have on those communities long term?
Well, it's important to understand that you have to address these conversations with an understanding of the history. And if you don't, I think you lose trust pretty quickly. So we've acknowledged the Tuskegee experiment. We've acknowledged the cells that were taken from Henrietta Lacks many, many years ago at Johns Hopkins and used for science without crediting her or even asking her permission. And all of that is important in the conversation. We're doing 2 mobile vaccination events today. We've given 1,000 shots at these mobile events. But what we're doing beforehand is going door to door and having these conversations with people. And one point we do make are the exact stats you just quoted around how the actual virus has killed proportionally more Black and brown people than the general population. So thankfully that's working, and I hope to get our vaccination rates up compared to the rest of the country.
And as I said, it's misinformation, because Tuskegee was when they wouldn't give the penicillin to Black men, not that they were giving them shots. But it's not just skepticism anymore. It's also the concerned misinformation efforts out there preventing people from getting their shots. Let's talk about your city, Newark. What are medical professionals like yourself doing to combat misinformation about the vaccine, especially in communities of color?
But one thing we've learned is that you can't have these conversations from the podium. You can't do it on camera. It has to be in person. And that's why I'm having lunches personally with our employees. I can't abide by the risk any longer of us spreading this disease amongst ourselves and certainly to the community of vulnerable patients that we see every day. And that's important. And the Surgeon General's guidance on how to combat misinformation asks us all to do exactly that. Healthcare professionals, but also citizens, residents, and communities can have these tough conversations with people who are skeptical and combat the lies that are on social media spreading every day. So we're seeing that work, and it requires hard work, but we're absolutely committed to it. And every leader of every stripe and political affiliation should be doing the same.
Dr. El Nahal, thank you for being with us. Up next, Congress is set to begin its probe into January 6th insurrection and the dangerous right-wing groups involved in the storming of the Capitol. My next guest actually journeyed into the world of white supremacy. You don't want to miss this one.